Masego, good afternoon to you. So what is the update on this as the hunt continues for the 21, and what are the authorities actually doing about it?
Good afternoon, Jeremy. Well, as you know, earlier this year, when the problem about the missing patients actually arose, the number was actually at more than 100. Remember, back in 2015, 2016, it was more than 1,700 patients who were moved out of Life Esidimeni facilities and taken to those 27 NGOs, which were, of course, later found to have been operating unlawfully. They had incorrect licenses, for instance, overcrowding, Jeremy. But what we do know is that since then, since the over 100, they have found some of the patients. At around February, the same department, the same MEC, Gwen Ramokgopa, released a statement saying that it was 45 patients who were missing, and now we are at 21. But to elaborate more on the questions that you have, Jeremy, I've got Dr. Kwebi Mere. She is acting in the position of Director of Mental Health in the province. She takes over the position, of course, from Dr. Makgabo Manamela, who resigned last December after testifying at those arbitration hearings. Dr. Mere, let's start off with these 21 patients. Why are we not finding these 21 when we've been able to find all the other ones? Because earlier this year, we were at over 100 patients. Now we are at 21. There are families who might be spending Christmas not knowing where their loved ones are. What is it that is prohibiting the department from actually concluding this matter now?
Ma'am, we're following up every individual patient's information. The challenge that we started with was that we had very poor record keeping throughout the project, so we couldn't see where every patient went. As we're currently following up the last 41 patients that we found, we all found them with their families at home using health services in the meantime. The challenge is many of these families have moved around. So, and that's why we're asking the public to support us, so that when we come to a family's address, they will tell us where the family have moved. So we do hope that we can find these 21 also at home.
Dr. Murray, I know you are not in this position that you currently are holding when the disaster, as we can refer to it now, happened. But it's taking so long to conclude this Life Esidimeni case. When are we likely to actually put this to rest? And just remember just the 144 who passed away, and not have all these these knots that are not tied, all these loose ends.
You're right to say that the case still continues. We haven't seen the start of the court cases yet. The police and the Special Investigating Unit is busy with following up all the evidence, all the witnesses currently, and we hope to see that only happening next year. But from the department side, we've done much in closing down the NGOs, making sure that all the mental health care users are in good mental health care NGOs. Our NGOs really are very good for the patients. We ensuring the quality of care. But then it's these pieces still laying around, like the 21 users that we're looking for. I've got hope that we should find more of them, especially since we started now to talk about it in the media again. There was offers coming how to help to support us in finding them.
Now, Dr. Murray, how is the public expected to now trust government after this tragedy? You know, how are people expected to now trust that their loved ones who are, suffering from mental illness will not, for instance, get lost because of a poor record-keeping system, because they were just put into buses to be taken to ill-equipped NGOs, nobody checked, and now, there was all of this mess that happened. How do people trust that, government has their best interest at heart from now on?
Yes, I think a government, and I'm not only speaking about Gauteng Health Department, all the other health departments, we're sitting together. We were looking at the mistakes we made. We've got an action plan, and never will this happen again in our lives. The poor record keeping was actually only whilst the project was happening. It was so much in a rush that records really got lost, the information about every patient. This will never happen again. I think politicians and heads of departments of health has all learned from this mistake, as well as the functional staff members, the healthcare professionals. And we are much more aware of all risks involved in such big projects that were not well planned and well thought over.
Dr. Murray, during the arbitration hearings, we heard from, for instance, your predecessor, Dr. Manamela, and how she was actually supposed to take the lead instead of listening to the MEC in terms of this project, because, of course, mental health is more on her shoulder more than it is on the MEC's shoulder. Are you practicing the same type of authority when the MEC tries to come with decisions that you feel are not good enough for the patients? Are you speaking up? How's your relationship with the MEC, and what is it that you're going to be doing differently to make sure that this vulnerable group in society is well taken care of?
Yes, ma'am. We've definitely even changed the policies. The first thing that we do now is to listen to families. Whenever we want to place a patient in an NGO, families are now requested to visit the NGO and to give us their cooperation and permission to move a mental health care user. But also to say that mental health care users can speak for themselves too. So to listen to the patient himself is also important. Otherwise, the relationship between politicians, heads of departments, and the functional professionals, we've learned a lot. Throughout the country, we're also listening more to the advocacy groups like SASOP, like the South African Federation for Mental Health, understanding that we are a team, we've got stakeholders outside the Department of Health, and if we don't listen to each other, we are going in the wrong direction.
Dr. Murray, I hear what you're saying, with the team working together, but now I just want to ask specifically what it is that you are doing differently for mental health care users as a person who looks after mental health in the province. Because, of course, like I said to you with the question earlier, there's a lot of people, for instance, that we've spoken to, families who had their family members at Life Esitimeni and will not even agree to taking them to Selby, for instance, where you took some of the patients after taking them out of those NGOs. They would rather sit with them at home. And we know how difficult it is to look after a mental health care user. You do need, a doctor that would look after them. You need that support. What is it that you're going to be doing differently to restore that trust from the people of Gauteng?
You're right to say that the break in trust will take many years really to restore, and especially when it comes to mental health care users. What we're doing differently is we're really listening to the needs, and we protect the rights of the mental health care users. You will also know that the Mental Health Review Board are now functioning totally different, really independent, and whenever there are challenges, appeals, or questions to be asked, the Mental Health Review Boards do get into the office of the MEC, and we address every individual problem immediately.
Now, those NGOs that were shut down, are they still shut down? Is the department checking on these NGOs to make sure that they're shut down?
Yes, ma'am, those NGOs are definitely closed, though the Department of Health is very aware that NGOs can mushroom and are mushrooming without any warning to the Department of Health. And I think that's one of the things that one can communicate out to the public out there, to say that it is illegal to have a home where you house more than 5 mental health care users without applying for a license and being overseen by the Department of Health. We're calling on everybody in the community to inform the health district offices or any of the clinics if they are aware of a house where mental health care users are being housed together and cared for or not well cared for.
Thank you very much, Dr. Murray. Well, there you have it, Jeremy, an interview with Dr. Kwebi Murray. She is the head of mental health in the province. It's back to you in studio.
Masego Ratlaga, thank you very much indeed as the hunt continues for those missing 21 life Esidimeni patients.